How often do you masturbate each week? 3 times? 5 times? Or every single day? You tell yourself, it's just to release some tension. But be honest, do you feel more tired afterward? Less interested in everything else? Do you carry a quiet guilt that lingers through the afternoon? After 60, many men fall into a silent loop. The more they masturbate to feel like a man again, the more exhausted, lonely, and empty they become. This video won't judge you. In fact, it will help you understand how much is enough, how much is too much, and how to masturbate in a way that restores your energy, not quietly destroys it. Because after 60, the issue isn't whether you still have desire. The question is this: are you using desire to heal or to hide? Leave a comment. How often do you masturbate right now? And do you feel stronger afterward? Or secretly more drained? This is a safe space to speak, because your strength is not in silence, but in having the courage to understand your body and reclaim it. It's not about frequency, it's about listening to your body. How often are you masturbating each week? What? 3 times? Or almost every single day? But here's the real question. How do you feel afterward? Relaxed? Energized? Or tired, empty, and a little uneasy deep inside? After 60, your body doesn't respond the same way it used to. Hormones shift. Circulation slows. But one thing remains: the desire to feel like a man, to stay connected to your masculine core. The problem is, many older men start using masturbation as a quiet habit to fill emotional space. But they're unsure if they're doing it too often. That's when the question arises: how much is too much? And the confusion begins. There is no magic number that defines manhood after 60. Only your honesty with your own body. Some experts say 1 to 2 times a week is ideal. Others say as long as you feel fine, don't worry. But the truth is this: the number doesn't matter. What really matters is whether you are listening to your body. Ask yourself these things. After you masturbate, do you feel lighter and recharged? Or sluggish, foggy, maybe even a little regretful? Are you doing it because you genuinely feel desire? Or because you're just trying to fall asleep? Or pass time in silence? Does it make you feel more confident? More alive? Or is it just a quick pleasure followed by emptiness? Healthy masturbation is a form of self-care. But overdoing it can slowly drain the very energy you're trying to reclaim. There are 4 key factors to consider. Your overall health. Are you already battling fatigue, pain, insomnia, or shortness of breath? Masturbation is still a physical act, and if your body is overwhelmed, it can take more than it gives. Your energy and natural desire. Are you still naturally aroused? Or do you need strong stimulation, fantasy, or even extreme content just to feel something? Real desire shouldn't have to be forced. Any chronic health conditions, diabetes, high blood pressure, prostate issues, heart disease, all affect your circulation, sensitivity, and mood. If you're dealing with these, be extra aware of how often you're masturbating. Your emotional state. Are you doing this out of joy? Or to escape loneliness, anxiety, or sadness? Masturbation is not the problem. But if it's the only thing that makes you feel alive, it's time to take a deeper look. Some men feel great with 3 times a week. Others are fine with once every 2 weeks. There's no one size fits all. The real sign is this: afterward, do you feel stronger or weaker? Let your body be the guide. Not your guilt. Not your habit. Not the silence. When you truly listen to your body, you'll realize masturbation should restore you, not numb something deeper. If you feel calm and clear afterward, if you sleep well, if you don't hide it or feel shame, and if it helps you feel connected to your manhood, then it's likely healthy for you. It's not the number of times that defines your strength as a man. It's what you feel in your heart after each time. The benefits of moderate masturbation after 60. First, let's talk about the benefits of moderate masturbation after 60. Because when done mindfully and with intention, not as an escape, but as a form of self-care, masturbation is not a harmful habit. It can become a tool for restoring physical and emotional health, especially as the body begins to slow down and hormones change. After 60, you don't need more, you just need better. 1. Maintaining erections by improving blood flow. One of the biggest causes of erectile dysfunction in older men is poor circulation. When blood doesn't flow strongly to the penis, erections become harder to achieve or impossible to maintain even when desire is present. Mindful masturbation helps stimulate blood flow to the erectile tissues. Think of it as light exercise for the vessels in your lower body, keeping them active and responsive. If you go too long without any stimulation, blood flow decreases. Smooth muscle tissue stiffens. Erectile tissues become less responsive. Recovery gets much harder. Muscles shrink without use. So does your manhood. Moderate masturbation, along with good nutrition and exercise, helps protect your natural erectile function, without relying on pills. 2. Balancing testosterone, the natural way. Many believe that testosterone simply declines with age. But here's what most don't know. Testosterone can still be maintained naturally if you know how to wake it up. Masturbation, when it involves real arousal and authentic stimulation, activates the hypothalamic pituitary gonadal (HPG) axis. It signals your body, I still need testosterone to support my manhood. As a result, your testosterone doesn't drop as rapidly. However, if you're masturbating out of boredom, stress, or habit, that internal axis becomes confused. Over time, it may even shut down the natural signal to produce testosterone. Masturbation doesn't lower testosterone, but doing it the wrong way makes your body stop producing it. That's why choosing the right timing and emotional state is essential. 3. Better sleep and improved mood. Ever notice how you sometimes sleep better after releasing tension? It's not a coincidence. Orgasm releases a surge of feel-good hormones, dopamine, oxytocin, prolactin, and serotonin. They calm the nervous system, ease stress, and promote a natural sense of peace. Oxytocin in particular is known as the bonding and comfort hormone. It's especially important for older adults living alone or facing emotional isolation. If you suffer from mild insomnia, anxiety, or low moods, mindful masturbation can be a natural therapy without pills. Sleepless nights don't always come from aging. Sometimes they come from tension you haven't released. But if you overdo it, or do it while feeling emotionally low, your body may not release those calming chemicals. Instead, you may feel even more lonely, tired, or disconnected. 4. Reducing prostate congestion, preventing inflammation. One benefit most men don't realize. Masturbation helps clear built-up fluids in the prostate, which may lower your risk of inflammation or prostatitis, a very common issue in older men. When you go too long without ejaculation, fluids in the prostate may stagnate. That environment can encourage bacterial growth and irritation. Masturbating once or twice a week helps release pressure in the gland and keeps it functioning smoothly. You don't need a partner to protect your prostate. You just need to avoid letting it stay blocked for too long. However, if you're already experiencing prostate pain, burning, or urination problems, talk to your doctor before continuing. In summary, masturbation after 60 is nothing to be ashamed of. If done with awareness and respect, not rushed, not compulsive, it can offer powerful benefits for both body and mind. Sex isn't always about connection with someone else. Sometimes, it's the most honest way to reconnect with yourself. But what if it's too often? Masturbation can be a normal, even necessary part of maintaining sexual health after 60. But like any habit, when it goes beyond a healthy limit, it stops being medicine and becomes a slow addiction. There's a thin line between self-care and self-harm without realizing it. And if you cross that line too often, the consequences will show up, physically, emotionally, and even relationally. It's not that you still want it, it's that you can't stop. And that's when it becomes dangerous. 1. Reduce sensitivity, when you overuse or use the wrong way. The penis is a sensitive organ filled with nerve endings, but it's also prone to becoming desensitized. Frequent masturbation using strong pressure, rough strokes, or unnatural positions, like tight grip or aggressive rubbing, can slowly deaden the sensitivity of the glands. At first you may reach orgasm easily, but over time you'll need more intensity, more time, and more stimulation, just to feel something. When you lose sensation, you start using force. But the more force you use, the more sensation disappears. The result: when you're in a real intimate moment, the feeling is dull. You struggle to enjoy it, because your body has adapted to unnatural stimulation. 2. Guilt and stress. If you feel dependent. Many older men confess that they don't actually want to masturbate anymore, but feel like they have to. Because if they don't, they get restless, anxious, or can't sleep. That's no longer a choice. That's a quiet form of dependency. After each time, instead of feeling lighter, they feel drained. Instead of relaxation, they feel shame. Instead of confidence in their body, they feel like they gave in to something they no longer control. Healthy masturbation brings comfort. Unhealthy masturbation brings conflict within yourself. This guilt doesn't come from religion or culture. It comes from a deeper place, where you know something inside you is no longer balanced. 3. Disconnection from real life and your partner. When masturbation becomes a secret, repetitive habit, it starts to replace real intimacy. You may lose interest in physical closeness with your partner. You might avoid sex using excuses like fatigue, back pain, or low mood. In truth, the desire is still there, but you've already spent it all in isolation. Your body becomes used to being alone. Your mind starts associating pleasure with solitude, not connection. Some men touch themselves every day, but forget how to truly touch the one they love. 4. Warning signs you shouldn't ignore. You don't need to wait until your health crashes. Watch for the silent signals your body and mind are already giving you. You must masturbate daily or you feel anxious or sleepless. You feel exhausted, numb, or irritable afterward. Your sleep is worse or your mind won't settle. You avoid your partner or feel disconnected from intimacy. You feel shame or guilt but can't stop the habit. When masturbation stops being a choice and becomes something you need to function, you're no longer in control. You don't have to quit completely. What you do need is to regain control. Not let desire drive you blindly, but understand it, manage it, and use it as a healthy, healing part of life. Instead of repeating a habit that leaves you drained, learn to pause, feel differently, and transform pleasure into restoration, not depletion. Masturbation isn't shameful, but doing it every day in secret and exhaustion, without knowing why, is a red flag. You deserve to live with strength, clarity, and dignity. You don't have to abandon your desire. You just need to recognize when it's nourishing you, and when it's silently wearing you down. So, after 60, how much is too much? One of the most confusing questions for older men is this: am I masturbating too much? You don't know who to ask. No doctor brings it up in a routine checkup. There's no standard posted in your bathroom. But your body, if you listen carefully, always knows how to speak. Imbalance doesn't start with pain. It starts with a subtle feeling that you're no longer yourself. 1 to 3 times per week is a safe range for most men over 60. If you need a number to start reflecting, this is the recommendation from many sexual health experts. 1 to 3 times per week is generally a healthy range for most men over 60, especially when paired with good nutrition and light physical activity. Why? Because at this pace, your body has time to fully recover after ejaculation. Hormone levels remain stable. The prostate regularly clears out, reducing stagnation. Your mind resets between sessions, avoiding overstimulation. A few times a week is like a gentle supplement. A few times a day is like overdosing on something meant to help. But remember, this is a guide, not a fixed rule. 2. Some men do more, and they're still fine. There are men in their 60s or 70s who masturbate 5 or 6 times a week, even daily, and experience no problems at all. They don't feel drained. They sleep well. They stay physically active and emotionally balanced. They're not hiding the habit. They still enjoy connection with others. For them, that frequency isn't too much, because their body handles it well. The issue only arises when you feel exhausted, not refreshed afterward. You begin to feel dependent, even addicted. You try to stop but can't. Too much isn't about how often. It's about whether or not you're still in control. 3. Signs that you might be going too far. If you're unsure whether you're overdoing it, pause and ask yourself these questions. Do I feel tired or sluggish after I ejaculate? Do I often feel empty or low energy? Has my sleep or concentration gotten worse? Am I hiding this habit or feeling ashamed of it? Am I doing it out of restlessness, not real desire? If you answered yes to 2 or more, your frequency may be exceeding your body's ability to recover. Numbers don't lie, but your body's feeling after each time is the real truth. 4. How to find your own healthy rhythm. Instead of forcing yourself to match someone else's pace, define your own ideal frequency based on 3 pillars. Body, emotion, relationship. Body, do you sleep well? Feel energetic? Any signs of fatigue, pain, or urinary issues? Emotion, do you feel calm and satisfied afterward or anxious and guilty? Relationship, are you still interested in intimacy with a partner? Or are you withdrawing from real connection? When these 3 areas are in harmony, whether you do it once a week or 3 times a day, you're still in balance. This is not a race. You don't need to masturbate regularly to prove your masculinity. You just need to understand, honor, and follow your own natural rhythm. 5. Don't count the times, listen to your body. The truth is, there is no magic number that works for everyone. Your age, health condition, energy level, and emotional state all influence your needs and capacity. You might do it more often than others, and feel strong. You might do it less, and still feel complete. And both are equally valid. Power isn't found in how often you do it. It's found in how clearly you can feel your body afterward. Because after 60, what you need isn't quantity. It's quality, not more. But what's right and enough for you, for your health, and for your quiet, steady manhood. Healthy masturbation tips after 60. After everything we've shared, the benefits, the warnings, the ideal frequency, there's one more essential piece. How you masturbate can determine whether you're healing your body or slowly harming it. Age doesn't take away your desire, but it demands that you treat your body with more care and wisdom. Here are 4 simple yet powerful tips that can transform your experience, if you take them seriously. 1. Use lubricant to protect thinning skin. As you age, the skin on your penis becomes drier, more fragile, and prone to irritation. Masturbating without lubricant, especially with strong pressure, can cause micro tears, burning, or inflammation you may not even notice. Choose a water-based or silicone-based lubricant, unscented and free of harsh chemicals. Using lubricant not only makes movement smoother, it also allows you to feel more pleasure with less force, helping to preserve sensitivity over time. When you are gentle with your body responds with gentleness. 2. Change techniques, don't let yourself go numb. One major reason many men lose sensitivity is because they use the exact same technique for years. Same grip, same pace, same position, over and over. That routine dulls the nerves. Your body gets used to the pattern and stops reacting with the same intensity. Try slowing down. Switch hands. Explore different types of touch, not just focusing on the tip but the base, testicles, inner thighs. You can even try standing, sitting, breathing deeply, or meditating while doing it, to create a completely new experience. Boredom doesn't come from your body, it comes from doing the same thing too many times. 3. Don't rush, slow down and be intentional. Masturbation is not a chore. It's not a secret task to help you sleep or distract from loneliness. If you treat it like a ritual, a mindful, quiet practice, you'll feel far more than just pleasure. You'll feel connection. Many men in their 60s say this. When they stopped rushing and started slowing down, their pleasure became deeper, more real, and they no longer felt exhausted afterward. Take 15 to 20 minutes. There's no need to climax immediately. Just connect with your body. Feel every subtle sensation. Let pleasure come to you, not as a goal but as a gift. Sex isn't always about climax. Sometimes a soft touch and steady breath is what restores your manhood. 4. Combine with pelvic floor exercises to boost erection strength. If you want stronger, longer-lasting erections and better control, there's no better solution than pelvic floor training, Kegel exercises. Imagine you're trying to stop urination mid-flow. The muscle you squeeze is your pelvic floor. Practice tightening that muscle for 10 seconds, resting for 10 seconds. Repeat 10 times a day. You can do this while sitting, lying down, or even during masturbation. When this muscle is strong, blood flows better to your penis, and you'll feel a noticeable difference within weeks. The penis has no muscle, but it can be supported by the quietest muscles in your body. In summary, when done the right way, masturbation is more than just a physical release. It becomes a gentle ritual, a way to slow down, listen, and reconnect with yourself. You don't need to do more. You just need to go deeper, go slower, and understand where and why you're touching. And after 60, that is a gift you truly deserve. A closing note for you. We've just explored a topic that few dare to speak openly about, yet almost every man faces silently. Masturbation after 60. You've learned that there is no ideal frequency, only how your body responds afterward. When practiced mindfully and in moderation, masturbation can offer real benefits: improved blood flow, balanced testosterone, better sleep, and prostate health. But when overdone, it can lead to numbness, tension, isolation, and dependence. And above all, it's how you do it, slowly, intentionally, and with self-awareness, that holds the key to preserving your strength and self-respect. Desire is not the enemy. But when we no longer understand why we act on it, that's when we begin to lose ourselves. And what about you? How often are you masturbating each week? Do you feel comforted or drained? Are you in control of the habit, or is it quietly controlling you? Leave a comment below. Not to show off, not to confess guilt, but to begin your journey of understanding and reclaiming your own body. If you found this video helpful, please share it with another man who may be quietly carrying the same questions. And don't forget to follow the channel, so we can meet again in honest conversations about real health for real men. You are not fading. You just need to be reminded you still matter, and you still deserve a natural, healthy, and deeply personal kind of masculinity.